Breast cancer is a type of cancer that forms in the cells of the breasts. It is the most common cancer among women worldwide, but it can also affect men. Breast cancer can occur in different areas of the breast, including the ducts, lobules, or other tissues. Causes. The exact cause of breast cancer is not known, but there are several factors that may increase the risk of developing the disease. These include age. Breast cancer is more common in women over the age of 50. Gender. Women are more likely to develop breast cancer than men. Family history. Women who have a first-degree relative, such as a mother or sister, who has had breast cancer are at a higher risk of developing the disease themselves. Genetics. Mutations in certain genes, such as BRCA1 or BRCA2, can increase the risk of breast cancer. Hormones. Women who have been exposed to high levels of estrogen, such as those who started menstruating at a young age or went through menopause at a later age, may be at a higher risk. Lifestyle factors. Obesity, lack of physical activity, and alcohol consumption can also increase the risk of breast cancer. Symptoms. In the early stages, breast cancer may not cause any symptoms. However, as the cancer grows, it may cause a lump or thickening in the breast or underarm area, changes in the size or shape of the breast, nipple discharge or inverted nipple, skin changes, such as redness or dimpling, breast pain or tenderness. Diagnosis. Breast cancer is usually diagnosed through a combination of imaging tests, such as mammograms, ultrasounds, or MRIs, and a biopsy, which involves removing a small sample of tissue from the breast for examination under a microscope. Treatment. The treatment for breast cancer depends on several factors, including the stage of the cancer, the type of cancer, and the patient's overall health. Treatment options may include surgery, radiation therapy, chemotherapy, hormone therapy, or targeted therapy. Prevention. While it may not be possible to completely prevent breast cancer, there are several steps women can take to reduce their risk. These include maintaining a healthy weight, exercising regularly, limiting alcohol consumption, breastfeeding, which has been shown to reduce the risk of breast cancer, getting regular mammograms and clinical breast exams. Women should speak with their healthcare provider about when to begin mammograms and how often to have them. Here are some additional details about breast cancer. Types of breast cancer. There are several types of breast cancer, including ductal carcinoma in situ. This is a non-invasive type of breast cancer that forms in the milk ducts and has not spread to nearby tissues. Invasive ductal carcinoma, IDC. This is the most common type of breast cancer, which starts in the milk ducts and can spread to nearby tissues. Invasive lobular carcinoma, ILC. This type of breast cancer starts in the milk-producing glands, lobules, and can spread to nearby tissues. Inflammatory breast cancer. This is a rare but aggressive form of breast cancer that can cause redness, swelling, and warmth in the breast. Triple-negative breast cancer. This is a type of breast cancer that does not have receptors for estrogen, progesterone, or HER2, which makes it harder to treat. HER2-positive breast cancer. This type of breast cancer has too much of a protein called HER2, which can cause the cancer cells to grow and divide more quickly. Stages of breast cancer. It is also classified into different stages based on the size of the tumor, whether the cancer has spread to nearby lymph nodes, and whether it has spread to other body parts. The stages range from 0, non-invasive, to 4, advanced cancer that has spread to distant organs. Treatment for breast cancer. The treatment for breast cancer depends on several factors, including the stage and type of cancer, the patient's age and overall health, and other individual factors. Some of the common treatment options for breast cancer include surgery. This may involve removing part of the breast, lumpectomy, or the entire breast, mastectomy. Radiation therapy. This uses high-energy radiation to kill cancer cells and shrink tumors. Chemotherapy. This uses drugs to kill cancer cells throughout the body. Hormone therapy. This can be used to block the effects of hormones that can fuel the growth of some types of breast cancer. Targeted therapy. This uses drugs that target specific molecules or proteins that are involved in the growth and spread of cancer cells. Prognosis. The prognosis for breast cancer depends on several factors, including the stage and type of cancer, the patient's age and overall health, and other individual factors. With early detection and prompt treatment, the prognosis for breast cancer is generally good, and many women can go on to live long and healthy lives after treatment. However, advanced stages of breast cancer can be more difficult to treat and may have a poorer prognosis. Risk factors. In addition to the factors mentioned earlier, there are several other factors that may increase a person's risk of developing breast cancer. These include personal history of breast cancer or other breast conditions, previous radiation therapy to the chest area, genetic mutations, such as BRCA1 or BRCA2 gene mutations, dense breast tissue, exposure to estrogen or other hormones, such as through hormone replacement therapy or birth control pills, smoking. Screening. Screening for breast cancer can help detect the disease early, when it is more treatable. The American Cancer Society recommends that women with an average risk of breast cancer start getting mammograms at age 40 and continue to have them every year. Women with a higher risk of breast cancer may need to start getting mammograms earlier and or have them more frequently. Clinical breast exams and breast self-exams are also important for early detection. Breast cancer in men. Although breast cancer is much more common in women, it can also affect men. Men have breast tissue, and although it is much smaller than women's breast tissue, it can still develop cancer. Men with a family history of breast cancer or genetic mutations that increase the risk of breast cancer may be at higher risk. Support and resources. Breast cancer can be a difficult and emotional experience for patients and their loved ones. There are many resources available to provide support and information, including support groups, counseling services, educational materials, online communities and forums, financial assistance programs. Conclusion. Breast cancer is a complex disease that affects many women, and some men, around the world. While there is no surefire way to prevent breast cancer, there are many steps that individuals can take to reduce their risk and detect the disease early. With prompt diagnosis and appropriate treatment, many people with breast cancer can go on to live long and healthy lives.